Okay, we have a front view or norma frontalis. We have the frontal bone high up, showing these two prominent pieces of bone to know this is a male if we have this kind of prominent called frontal eminence. If you go lower down, you have above the orbit, this is the orbit, the cavity where the eyes are in. We have supraorbital or supraciliary ridges like those. In each, we have an opening called supraorbital foramen. Why for? A nerve and an artery are coming out to supply the area with sensation. In between these two supraciliary ridges, we have this area called glabella. If you go lower down, this is the nasal bone, bones of your nose. Nasal bones are actually two bones unite together by another suture called intranasal suture. The root of this one is called nasion, this area. Okay? Two nasal bones are having two openings anteriorly. Anterior nerves in flesh, or these two openings. And the nose had by its middle, and exactly in the midline, what's called nasal septum. Nasal septum should be exactly a midline structure. Most anteriorly, we have the anterior nasal spine. Anterior nasal spine. If you look to the nose from inside, the lateral wall has what's called conchae. This is superior concha, this is inferior concha. Sometimes we have a middle concha. Okay, let's go for the orbit. The orbit has all these kind of boundaries: superior wall, lateral wall, medial wall, inferior wall. It shows two openings or cracks: superior orbital fissure and an inferior orbital fissure. Structures passing through you're not asked about. If we keep going lower down, you still have here the cheekbone or the zygoma. Lower down, this is the maxilla or the upper jaw. Lower down, we have this superior alveolar margin for the upper jaw, and with the mandible, this is the inferior alveolar margin. Each should have sockets for the teeth. We have one more opening below the orbit called infraorbital foramen, again for an artery and a nerve passing through. If you go more lower down, we have another opening by the mandible called mental foramen. If I have a ruler and I make a straight line, it should pass with the three: supraorbital, infraorbital, and mental foramen. If you look to the skull from a side view, norma lateralis. Norma lateralis, you can see above here is the parietal bone, lower down temporal bone, unite together by this temporal suture. We can see two lines can be faint like this is one line. I can see one line here, and I can see another line right over there. The upper one is called superior temporal line, the lower one is called inferior temporal line. A muscle attached to the superior temporal line called temporalis. We use it in plastic surgery to remove wrinkles with age. If you go lower down, we have here the zygomatic arch. More down, more back, we have this opening for the ear, outer ear, called the external auditory meatus. Back to it, we have the mastoid process. Okay, the mandible, we are going to discuss it in details later. Okay, this is all what you need to know for a side view. If you go to a back view, norma occipitalis, it shows these features: this prominent piece of bone, external occipital protuberance. Coming down from it, we have this crest, a ridge of bone called external occipital crest. On each side, we have three lines. Two should be normally present. This is one, and this is one, and this is the lower one. Lower one. Someone may or may not be present. What are the names of these three lines? The highest nuchal line may or may not be present, and then superior nuchal line should be there, and then inferior nuchal line should be there. That's all what you need from an occipital view. Now we go for the skull from a basal view, or norma basalis externa. You have here, this is your palate. Your palate, we like to divide it into anterior two-thirds on each side, and a posterior 1/3. Anterior 2/3, we can name this piece of bone as maxillary palatine process of the maxilla. You can easily analyze the name. This is the main bone called the maxilla. It's going to send a process to the palate, so we name this as palatine process of the maxilla. And then, what about the posterior 1/3? Posterior 1/3, it's the horizontal plate of ethmoid. Horizontal plate of the palate. We are discussing the palate in specific. Why horizontal? Because if we compare this to this plate, this is vertical and this is horizontal. We need this horizontal as a completion of the palate from the back. At the most back of the palate, we have that spine, posterior nasal spine. You remember the anterior nasal spine? This is the posterior nasal spine. This opening is called foramen cecum. Foramen cecum. Okay? If you go more back, we have the two nasal openings from the back. And this is the nasal septum. Lower down, we can have this piece of bone called vomer. You can see it from a front view, but it's better from a back view. This is the vomer. On each side, we have two plates, lateral pterygoid plate, medial pterygoid plate, and in between you have this shallow cavity. So that's a medial pterygoid plate, lateral pterygoid plate, and the pterygoid fossa. More backward, I have this bone, basilar bone of the skull. This is the strongest piece of bone all over your body. If you got fracture of this bone, that's a chance of life is going to be 5%. And this is very dangerous at the base of the brain to be fractured, that bone. Okay. Now we go to the openings at the base of the skull from outside. The key point is the oval shape window, which is the foramen oval. Oval shape. Back to it, we have the foramen spinosum. Medial to it, between it and the basal bone, we have an opening that has a lacerated edge, and that's why it's named foramen lacerum. If you go more backward, we have an opening which is not open from the other side. This is for an artery called internal carotid artery. It goes and then leaves right away. And this we name it as carotid canal. If you go more back, we have a huge opening called jugular foramen. One of the contents is the jugular vein running in your neck. We still have another opening, should be here. This is for the cranial nerve number 12, hypoglossal foramen. You have it on each side. We still have one more opening, this one. I'd like to name that one. This piece of bone is called styloid process. This is the mastoid process. So the name of that foramen, stylomastoid foramen, which is that one. Of course, this is the huge opening called foramen magnum for the spinal cord. Next is going to be the skull from an inner view. Okay, the skull from an inner view, or norma basalis interna. We have these structures. Of course, before I start, I'd like to divide the cavity of the skull from inside into 3 more cavities. See the edge of that lesser wing of a sphenoid? Anterior to it, this is the anterior cranial fossa. Between this edge of the lesser wing and the end of the greater wing of a sphenoid, which is this one, we have the middle cranial fossa. Back to this edge, we have the posterior cranial fossa. Structures in the anterior cranial fossa. We have here, again, the foramen cecum. Back to it, I have the crista galli. On each side, I have the cribriform plate. Why for? We have the nerve filaments of the cranial nerve number 1 are running through each one of these kind of openings. And then, more back, I have the tip of the lesser wing of a sphenoid. I have the anterior clinoid processes. Nearby, I have an opening called optic foramen. This is for the cranial nerve number 2 for vision, going to the eye. More backward, I have a concave shape area. a protection for a very important endocrine gland. This area is called dorsum celli or hypophyseal fossa. The pituitary gland, the maestro of all endocrine glands, is located in this area. Back to it, another protection. It's called dorsum celli. On each side of the dorsum celli, we have two prominent pieces of bone. Each is named posterior clinoid processes. Those are the two anterior, those are the two posterior clinoid processes. Okay? Now we'd like to go for the openings or the foramina in this base. Just lower down to the lesser wing of a sphenoid, I have this crack, superior orbital fissure. And then the same openings, like from outside, we have the foramen ovale, back to it foramen spinosum, medial to it foramen lacerum. We need to add one more opening, foramen rotundum. Foramen rotundum on each side. And then I have the carotid canal for the artery, the same artery. Runs and then leaves, so it's not open from the other side. These two areas. More back, I have the jugular foramen, the same like from outside. Here is the hypoglossal foramen. I'm adding one more, which is internal auditory meatus. You remember we had from outside external auditory meatus. If you pass a piece of wiring, it should come out from this internal auditory meatus. More backward in the occipital bone, you still remember these changes are the same inside, but you name it internal. So here is the internal occipital protuberance, internal occipital crest, and the three lines are quite clear here. This one is the superior nuchal line, inferior nuchal line. Highest nuchal line is faint here, may or may not be present. This is all what you need to know from an internal view. This is the mandible. Mandible is made of two halves, united by the middle here in what's called symphysis menti. Even each half, we further divide it into ramus, which is this piece, and the body, which is that piece. What about the ramus? Ramus has a head, or a condyle, or you can name it condyloid process, and then a notch, mandibular notch, and then a triangular shaped piece called coronoid process. Coronoid process. And if you go lower down, this is the angle of the mandible. The body of the mandible has the opening we mentioned before, mental foramen. When you study the mandible from an inner view, this is from an outer view. Of course, you already know that this is the inferior alveolar margin for the teeth of the lower jaw. When you study the mandible from an inner view, we have this piece of bone called lingula, a projecting piece of bone. And then we have an opening here leading to a canal here, or a tunnel inside. This is called mandibular canal. Inside it, a nerve called inferior alveolar nerve. If you go to your dentist and he's planning to do a root canal, this is the nerve that gets the anesthesia to make numbness of your mandible while he's doing the surgery. So this is the inferior alveolar nerve, runs through the canal and then comes out through the mental foramen as the mental nerve. So it enters an inferior alveolar nerve and comes out as a mental nerve. This is all what I'd like you in simple to know about the mandible.